Welcome to Under the Needle, where we explore what really lies beneath each acupuncture point through a modern anatomical and neurophysiological lens. Today, we're breaking down stomach 36, one of the most powerful and clinically versatile points in acupuncture. Stomach 36 is located on the anterior lateral aspect of the lower leg, approximately 3 cun inferior to stomach 35 and 1 finger breadth lateral to the anterior crest of the tibia. To locate this point, begin by palpating the sharp anterior border of the tibia. Slide laterally off the bone into a soft muscular depression, which is the tibialis anterior muscle. Stomach 36 lies primarily over the tibialis anterior muscle, with deeper contribution from the extensor digitorum longus. The tibialis anterior originates on the lateral tibial condyle and upper lateral tibia, and inserts onto the medial cuneiform and first metatarsal. It plays a critical role in dorsiflexion and dynamic ankle stability during gait. The deep fibular nerve runs nearby within this anterior compartment, along with the anterior tibial artery and vein. Since this region is muscular, vascular, and neurologically active, stimulation of stomach 36 can create both local neuromuscular effects and systemic autonomic responses. As the needle is inserted, it interacts with the following structures in a sequential order: the skin and superficial fascia, followed by the deep fascia of the leg. Next, the needle comes into contact with the tibialis anterior and extensor muscles of the leg. Finally, neurovascular structures within the anterior compartment, including the deep fibular nerve, and anterior tibial artery and vein. Stomach 36 corresponds primarily to the 4th and 5th lumbar spinal segments. These segments contribute to motor control of the tibialis anterior, lower limb proprioception, and ankle dorsiflexion instability. From a neurophysiological perspective, stimulation of this point activates somatic afferents that modulate the lumbar spinal cord, affects descending inhibitory pain pathways, and regulates the autonomic nervous system via brainstem connections. In addition to the treatment of knee and leg pain, this explains why stomach 36 is also used for digestive dysfunction, general fatigue, and immune regulation. Additionally, stimulation of stomach 36 and surrounding points influences vagal tone, as well as the systemic inflammatory response. As such, stomach 36 is one of the most versatile points for both local and systemic treatment strategies. From a traditional perspective, stomach 36 tonifies qi, strengthens the body, and supports digestion. Anatomically, its location over the anterior compartment of the leg places it in direct relationship with major somatic afferents and vascular structures. When we integrate both perspectives, we begin to see how mechanical stimulation of muscle and fascia can influence both local biomechanics and the central nervous system. Understanding both models sharpens clinical reasoning and improves outcomes. This is just one example of the anatomy we explore. If you want to study all acupuncture points systematically, deepen your clinical understanding, and earn continuing education credits, the Anatomy of Acupuncture Atlas and the full online course walk you through the entire framework. You'll find the links in the description.